You're sitting on a table, there's a curtain behind you, and you're surrounded by an assortment of medical professionals. The doctor's asking you some questions. He asks you, what color is the sky? You answer correctly. He asks you what today's date is. You hesitate. The answer's there, but you can't quite say it. You can't get the words to form. You start to panic. Your heart rate increases. But the doctor tells you that everything's going to be okay. What you just imagined is a glimpse into an awake craniotomy. What is an awake craniotomy, you might be asking? This is a brain surgery that is performed while the patient is awake in order to maintain the function of necessary parts of the brain. This procedure is only done in very particular circumstances. Most neurosurgeons don't choose to do it unless they absolutely have to, like if it's in vital areas of the brain that are necessary for your functioning. They use an electrical probe, electrical stimulation, to check the areas of the brain as they operate on them to make sure that everything is going smoothly and that they're not affecting you. And this is much safer than it sounds, even though it's a little terrifying. You see it a lot on television, but it's not done as much as you think that it is. So, why does someone have it? Like I said, it's done in very particular circumstances. If it's in areas of the brain like speech, your vision, or hearing, this is when a doctor will opt to do an awake craniotomy. It's safer than general anesthesia, which is when you're completely asleep. Because when you're completely asleep, the doctor can't necessarily see if what he's doing is going to impact your functioning post-surgery. And so, you being awake, they're able to see that before they operated on an area, they're able to see what would happen if they messed with that specific area. And the patients also have to be willing for this procedure and have to be prepared for what is to come, because it's kind of terrifying sitting there awake as a surgeon is operating on you. Western General Hospital did a study that showed that the patient's anxiety decreased with this procedure when the doctor went through every single part of the procedure with them, told them the questions they were going to ask them, and the whole shebang. And their anxiety went down tremendously, and they were much more readily acceptant of the procedure. So now that we know why you have their procedure, let's talk about how the procedure is performed. I'm not going to get gory and I'm not going to get gruesome. I'm not going to talk about the actual biology of it, but I am going to talk about the electrical stimulation of the brain once they're in there. So Time Magazine did an article where they followed a woman who had an awake craniotomy because she had a tumor in her speech center. And so they opted to do this so that during operation they wouldn't take away her ability to speak. And they did this by putting the electrical stimulation on the brain, because that's how our brain sends signals throughout it whenever something needs to happen or the brain needs another part of the body to function. It'll use electric currents in order to send its signals. And so they apply electrical stimulation to the area of the brain and ask them a bunch of questions depending on what area they're in. And doctors in Taiwan did an article where they showed all the questions that they would particularly ask depending on where they were at. So questions like, if you're working in the speech center, they're going to just ask you general questions to see if you can respond. And then if it's in an area that's important for vision, they'll ask you questions about what color do you see, what shape do you see. And these are the kind of questions that they're going to ask, and they're going to be specific to the area that they're performing the operation in. So, electrical stimulation, wide awake, is that even safe? It's much safer than it sounds, because normal surgery is much too dangerous. As I said, when a surgeon is in there under general anesthesia, when you're asleep, they aren't quite sure what the effects of that surgery are going to be. But when you're wide awake, they're able to see if they're going to have any post-surgical symptoms or complications from that surgery. A Neurological Techniques article says that you have shorter hospital stays, you have higher recovery rates, and higher life expectancy with an awake craniotomy versus regular surgery on the brain. And this is because you don't have to stay in the hospital as long, because they saw the effects of the surgery as they were performing it instead of waiting to see it 2 weeks after when the complications arose. And this is optimal because patients don't want to stay in the hospital for very long, and it also is much safer and increases your survival rates, so that's a good thing. And there's also multiple people present during this operation, which makes it as safer than it sounds. The same neurological techniques article said that an anesthesiologist, physical therapist, clinical nurse specialist, surgeon, scrub nurse, and nurse neurophysiologist can be present. So that's at least 6 people that are constantly watching you and keeping an eye on your vitals during this procedure. And so if anything goes wrong, they're the ones that are going to respond. But the good news is, even though it's terrifying, it is safer than it sounds, and very few people have this procedure. And most people who do have it end up waking up a lot better than they were when they went into it. So it's as simple as a good sleep for a little bit, answering a few questions, and getting a pretty cool scar. And this surgery has been groundbreaking for the neurosurgery field.